Hello guys, I'm Deepak Shukla. Welcome to our channel Study Mania. Today let's learn about tuberculosis of larynx. The mode of infection is air droplets, and often there is association with pulmonary tuberculosis because the route of entry is same, that is larynx. So there is more chances of tuberculosis of larynx. The most common part involved is posterior part of larynx, anterior part is less involved. Tuberculosis in other locations is a painless condition, like if it is in nose, ear, or other places. Tuberculosis is usually a painless condition, but laryngeal tuberculosis is extremely painful. So the chief complaints will be odynophagia, that is painful swallowing, and throat pain. There will be change in voice. If someone asks you what is the first presenting symptom in tuberculosis of larynx, there will be weakness of voice. Okay, weakness of voice is the first presenting symptom of tuberculosis of larynx. Coming to the signs, coming to the signs of TB larynx, we have first hyperemia of vocal cords. The first sign is hyperemia of vocal cords. Second is we have mammulated arytenoids or swollen arytenoids. Then we have mouse bitten or moth eaten appearance, that is discontinuous multiple ulcerations on the vocal cords. And the last sign is turban epiglottitis or swollen epiglottis. So we'll see this again. So this was glottis. The last sign was turban epiglottis, means this glottis has now become swollen. Now this is turban epiglottis. There was this vocal cord was there. So the first sign was hyperemia of vocal cord. Hyperemia of vocal cord, you can see here. Then we had arytenoids were there. No, these arytenoids will become swollen and mammulated. Mammulated arytenoids will be there. Okay. Then we have this small multiple discontinuous multiple ulcerations on the vocal cords will be seen. So this is the signs of TB larynx. Okay, the diagnosis is by culture. Okay, then we have to go for histopath, gene expert, and molecular methods. The treatment is anti-tubercular therapy. There is no role of surgery unless there is presence of any sulcus or granuloma. Okay, so this was about the TB larynx. Now coming to lupus larynx. Okay, so what do you mean by lupus larynx? Lupus larynx, it is a low grade or indolent tubercular infection. Okay, it is a low grade, it's just a type of low grade tubercular infection with lupus of nose and pharynx. The patient is totally asymptomatic and not associated with pulmonary tuberculosis. In this lupus larynx, this affects the anterior part of larynx. Okay, but in TB larynx, posterior part was most affected, and the epiglottis is the first to be involved. So what is the difference between TB larynx and lupus larynx? Okay, TB larynx is associated with pulmonary tuberculosis, but lupus larynx is not. TB larynx, the tuberculosis was active. Here in lupus larynx, it is indolent or low grade of tuberculosis. In TB larynx, the part affected was posterior, but in lupus larynx, the anterior part is affected. Mainly, the first thing is epiglottis. In TB larynx, it was symptomatic, but lupus larynx, there is no symptoms as such. So this was about lupus larynx and TB of larynx. So this completes our inflammatory reactions in larynx. Thank you so much.